Hey guys, Dr. Stephanie here, and today we're going to talk about sciatica. So I have 3 secrets for you for getting rid of that sciatica pain for good. I know a lot of people have had sciatica, and I'll briefly explain what it is, but it's no fun, and sometimes it seems like you can never get rid of it, and it really impacts all of your daily activities, all of your recreational activities, even your sleep sometimes. So basically, sciatica is a symptom. It's not an actual diagnosis because a lot of different things can cause sciatica, but sciatica basically means you have pain or numbness and tingling that usually starts up here and runs down the back of your leg. Now, sometimes it can just be here, sometimes it can just go to your knee, and sometimes it can go all the way down to your foot. And you can have numbness and tingling in your foot or pain in your foot as well. So obviously that sounds horrible. Nobody wants to have that. It's usually on just one side. Most of the time it's not both at the same time, but it can switch sides. So the goal of treating sciatica is to get rid of that numbness and tingling, get rid of that pain down your leg, and get rid of any back pain you may have too. So I'm going to give you those 3 secrets. Make sure you stick around to the end because I have a little bonus at the end, a little surprise, and that can help you get rid of your sciatica pain or numbness and tingling as well. So sciatica can be caused by, it can be coming from your back. Obviously you have a lot of nerves coming from your spinal cord. So if you have a herniated disc or just irritation at the nerve root kind of coming out of your spine there, that if there's any pinching or irritation there, that pinches on that nerve and causes that numbness and tingling and pain down your leg. It can also be caused, there's a muscle kind of deep in your butt called the piriformis. It's a hip rotator muscle. The sciatic nerve runs right next to that, sometimes through that in people, it depends on the anatomy. But that muscle, if that gets tight or irritated, it can irritate the nerve and cause those symptoms down your leg as well. So there's different things that cause it, but sciatica is basically no fun. So here are your 3 secrets. The first secret is you want to get rid of that nerve irritation and decrease the symptoms first. Basically, you want to get rid of the symptoms down your leg and centralize them to your back or your hip and then get rid of them. So it's okay sometimes if you get rid of those symptoms and you have a little bit more pain in your back. That's called centralization. And so if you get rid of those and you have more pain in your back or deep in your butt, that's okay. That actually means it's getting better. So in order to decrease that irritation, those nerve symptoms, I'm going to show you 3 things you can do. So we're actually going to start. I'm going to take this lacrosse ball, and if you don't have a lacrosse ball, you can use a tennis ball. You can actually use a foam roller as well. You're going to find a spot kind of deep in your butt, and you can do this sitting on the floor like me or sitting on a chair, and you're basically going to sit on that lacrosse ball or tennis ball or foam roller and kind of roll around, and you can roll to the side too. Find any spots that are tender, and you don't want this to be super painful, but it's okay if you find some tender spots. And if you find a spot that's tender, you can just spend a little extra time there, a few extra minutes, and just kind of roll around, find the tender spots. And that just kind of helps to release some tension. It's kind of like a soft tissue mobilization or massage. And that just kind of helps things relax. But you don't want it to be too painful because that can cause the muscles to kind of tighten up in response to that pain. So that's what you want to do first. Just do that for 2 to 3 minutes. Just roll around on it, find spots that are tender, kind of let those release a little bit. And then after you do that, you're going to lie on your back on the floor or on a bed, and whichever leg is involved. So say I'm having numbness and tingling down this leg, you're going to grab your hands behind your thigh, and then you're just going to straighten your leg as much as you can, pause for a second, and come back down. So you're just going to repeat this about 10 times. And this is just a nerve mobilization. So this is moving that sciatic nerve and trying to, because sometimes it kind of, if it gets irritated, it doesn't want to move, your muscles don't want to move, everything kind of just gets stuck and stiff. So this helps that nerve glide down its path, down the leg. So you want to do that about 10 times, and then you can relax. Hopefully that decreases some of the symptoms. And then the other nerve mobilization I'm going to do, and this is a little bit of a mobility move. So you're going to cross one leg over like this if you can. And then you're just going to pull your heel up towards you and then back down and then back up. And you want to do this 10 times. The knee that's bent, you can do this on both sides, but the knee that's bent is the affected leg. So you want to do this 10 times, just up and down, nice and slow. And if you can't go up very high, that's okay. Start out where you can. If this is a stretch, you can start here, or you can just move your heel a little bit and back down, but 10 times on that too. So that all of those three, those are going to kind of decrease those nerve symptoms and hopefully get rid of some of that numbness and tingling or pain that goes down your leg. So we want to reduce that irritation first. And then the secret number 2 is that you want to look at how your hips and your back are moving. So you want to work on mobility, because especially when you have pain or irritation, you stop moving because it hurts to move. But the secret is that you actually need to move to get rid of that pain. So I'm going to show you a couple of hip and lumbar mobility exercises. So we're going to do this first. So you're going to cross over like this, keep this knee bent, and you're just going to rotate side to side. So this is getting some hip mobility and some lower back mobility. You just want to do this about 15 times, just nice and slow, back and forth. And then you can also do this one on the other side. Usually I like to do this on both sides. And then just 15 times on the other side. Then from there, we really want to work on our hip mobility, because if our hips can move well, that reduces irritation on the back and the hips and knees. So we're going to do what's called a 90-90. So you're going to sit in this position. And if this feels too hard, you can actually start lying on your back and doing this. It's a little bit easier. So you can just keep your hands on the floor to start. And you're just going to rotate to the side. And as you rotate, kind of lean forward, keeping your back straight, and then rotate back to the other side and lean forward. And you want to do this for about, you can do 10 or 15 times each way. And none of these should be painful. It's okay to feel a little bit of discomfort or soreness, especially if you've never done these before. So back and forth about 10 or 15 times. And then we're going to go on our hands and knees and do a cat-cow. So this one works really on lumbar mobility, but on this, I want you to focus on going really slow, kind of pretending you're moving one vertebrae at a time. Just going to go up as high as you can and then slowly down. And you want to go 10 or 15 times to each side. So all of those are going to work on mobility. So first, we reduced the irritation in the nerves, and then we worked on mobility. And then the final secret is to work on building strength. So once we kind of get rid of the acute irritation, the really painful sciatica, the really, like feeling like you can't move, you can't do anything, once you kind of decrease that and you're feeling a little bit better, but it's not all the way better, you want to work on strengthening so that we get rid of it completely and keep the sciatica and back pain and hip and deep butt pain from coming back. So I'm going to show you a couple strengthening exercises. For this first one, you're going to use a band and just place it around your knees. Lie on your side, knees bent, and so you're just going to do a side plank. So lift that bottom hip and then lift the top knee and then come back down. You can do this without the band to start if you want to. You can also just start by doing the side plank lift, so lifting up and back down. And then when you're ready, you can add that knee lift. But this is going to work on core strength and hip strength. So you want to do 10 or 15 on each side. And then from there, we're going to go on our back and do a dead bug. And so you're going to keep your hands and feet in the air like this. Keep your back flat. And it's also important to kind of keep your core tight. So you want to kind of just pull your belly button into your spine a little bit. If you don't know if you're doing it correctly, place your fingers inside your hip bones and slightly pull your belly button to your spine, or kind of suck in a little bit like if you were zipping up a tight pair of jeans. And you should feel the muscles pop into your fingers right here. So you want to do that, and then you're going to lower one arm and leg, and then come back up. And then alternate on the other side, really focusing on keeping your back flat on the ground, keeping your core tight. And you can exhale as you bring your arm and leg down, and inhale as you bring them back up. And you want to do 10 or 15 on each side. To make that a little bit more difficult, you can use a weight. Hold the weight up in the air like this, and move your legs as you hold the weight. The weight just helps you stabilize your core. And again, 10 or 15 on each side. And then, while you want to work on strengthening hip and core, you also want to progress to some more challenging movements, some more dynamic movements. So basically anything can be a core exercise, because if you activate your core while you're doing it, then it's a core exercise. So a goblet squat is a great one to do. You just want to kind of pull that belly button into your spine, hold the weight, and then you're going to squat down and then back up. So a squat is a great exercise to progress to from that. Another one is a deadlift. So you can hold on to this weight, feet about shoulder width apart, knees slightly bent, and just going to hinge forward at the hips and then come back up. And hinge forward and come back up. And 2 to 3 sets of 10 of the squat and the deadlift are a great number to do. So those are the secrets. Secret number 1, get rid of that nerve irritation, do some nerve glides. Secret number 2, work on hip and lumbar mobility. Secret number 3, work on strengthening. So I said I had a little bonus for you. I have a low back pain recovery program. It's great if you want to build up core strength or hip strength. It's great if you have low back pain, or even if you just want to prevent it. And it's also great for sciatica. So if you want to, I'll link that below. If you want to do that, if you're having sciatica and you really need some extra help, I have a discount code for you. It's just 10 back off. And back off are capitalized. So you can use that code for $10 off and use that recovery program to help get rid of your sciatica, get rid of your back pain, and prevent it in the future. So hopefully this helped, and if you have sciatica, you can get rid of it for good.